The Nigeria Center for Disease Control and Prevention says it has launched an inquiry into the cause of a strange disease in Sokoto State. According to the NCDC, it has deployed a national rapid response team to work with the State Ministry of Health to further investigate and respond to the disease outbreak, which has claimed 4 lives in Isa local government area, where a total of 164 suspected cases have been identified in 6 wards, among children aged between 4 to 13 and some adults. Isa LGA tells us more.
Isa local government area of Sokoto State has witnessed a similar incident previously documented in 2023, also without a definitive diagnosis. This time around, since March 21, 2024, there has been reported cases of children presenting symptoms like abdominal distension due to the rapid onset of fluids in the abdomen, fever, vomiting, and weight loss. However, the NCDC says the disease may not be unconnected to activities like mining, agricultural practices, which involve the use of various types of chemicals and pesticides, as well as practices which may be detrimental to people's health in the affected communities.
They recorded those 4 deaths. Both of them were deaths from within the community, but the cases from the hospitals showed that perhaps again they had some renal complications of whatever might be causing it. You understand me? So before you come to any conclusion, you must make a diagnosis, or else you can't be treating blindly. So as at now, we don't have any cause of death. We are now expanding our level of investigation now to cover other things. The delay actually from the laboratories in Sokoto, because it took them a while to get back to us on the results of the testing for heavy metals. Is this one that just came out, I think yesterday or 2 days ago, that showed that there were high levels of lead and chromium in the sample sent. And that's why now the suggestion, look, let's test for other things that might be contaminated with whatever it is. So as at now, there is no definitive diagnosis. Most of the cases that in the teaching hospital are being treated symptomatically, and like Riley said, 1 or 2 of them are responding to treatment.
While emphasizing the need for adequate awareness on the disease to ensure prevention, he said, this is imperative despite the security challenges affecting access to the communities to search for more cases.
Level of awareness, yes, as it is now, because it's located in Sokoto State, it's specific to that area, and that's why again the state government again are actually increasing their public awareness to people in the state. But again, now one of the things we have to get information here, because there might be other states that have similar situations here which we don't know about. So it's on getting some of these things that we can now go out again and do a general publicity for the nation, especially those of them that have mining activities or use of pesticides. But when we get the correct culprit here, then it can give us an idea of how best to look at. But we can do a general thing right now based on what we have here now.
The NCDC is therefore urging healthcare workers, members of the affected and nearby communities to be vigilant and report anyone presenting similar symptoms to the nearest health facility. Isa LGA, Trust TV News, Abuja.